Today, I'm going to talk about COVID-19 and its impact in communities of color. First of all, I'd like to start with I will give you an historical view of COVID-19 and how it first came about here in the United States. You know, we first identified COVID-19 in December of 2019. And at that time, it wasn't called COVID-19, it was called the coronavirus. And it was discovered in a cluster of folks that had pneumonia in Wuhan, China. Then on January the 30th, the World Health Organization declared that it was a public health emergency of international concern. And in January of 2000, the US declared it a public health emergency, whereas there were only 7 cases known in the United States. So what we know is that the first known American deaths were in February, but we didn't know that it was caused by COVID-19 until April. In mid-April, however, we confirmed that the virus was in 50 states and that by November, it was in all territories. Now, if you look at the map here, you'll see the dark coloring of the map, and that's quite impressive. We see from December the 5th of 2020 to January the 13th of 21, the massive incline of the number of cases and deaths. On December, it was 14.7 million cases. And in January, we jumped dramatically to 23.7 million cases. So this is the coronavirus. And as we can see, the coronavirus, it's really quite pretty. It is named because of the spikes on its surface. It's crown-like. And what we know is that we identified the human coronavirus in the mid-1960s, and that there were 7 types of the coronavirus that could affect human beings. And of the 7, 4 of them commonly give us the common cold. And then the others later were MERS, which is the Middle Eastern Respiratory Syndrome. And then the SARS virus was the severe acute respiratory syndrome. And then the last one and most deadly has been SARS-CoV-2, which is COVID-19. So we all have heard about the symptoms and they're there for you. But I really want people to understand that, you know, how does the virus impact your body? Well, it impacts the lungs, you get the pneumonia. It impacts the immune system. Your immune system can be so revved up that it can actually attack itself. The heart, you know, people that have hypertension and cardiovascular disease are at higher risk than others. And blood vessels, we've all heard of people that may have had blood clots, and those blood clots go to the lungs, they can go to the brain. The brain, most people, when we think of the brain, I'm not gonna talk about it in the physical sense, but in the mental sense. And we have a speaker that will talk a little bit more about your mental health and how depression and anxiety are impacted by COVID-19. Lately, we talk about the liver, you know, having chronic liver disease and having elevated lipids. And then the kidneys. The kidneys are greatly impacted by COVID-19. So, you know, we want to talk about risk factors that have a more severe impact on you if you were to get COVID infection. And they are your age, your race, ethnicity, your gender. And we've already talked about some of the medical conditions like diabetes, asthma, COPD, obesity, cardiovascular disease, hypertension, pregnancy, being incarcerated. Those are some of the social factors that increase your risk. Being incarcerated, having close contact, racial biases in healthcare, and poverty and crowding, and occupations, which we'll discuss a little bit later on. So this is a busy slide, but I just want to say to you with age, if you look at age 18 to 34, those are the people in the state of California that have the highest percentage of cases. Initially, we thought that maybe it was about the older folks, but now we see that the number of cases are greatly increased in ages 18 to 34, and those numbers increase until age 59. Now, when we talk about the number of deaths, quite naturally, those at 65 or older have the highest number of deaths due to the COVID-19, with those 80 plus having the most percentages of death. So we look at what's happening in our community. And so what we've seen in the literature bears this out, that is we have experienced a disproportionately higher rate of COVID-19 infection. The literature talks about the differences in healthcare and access and exposure risks. They may be driving the higher infection and the mortality rate. We certainly know that social inequities increased health disparities, and lead to increased rates of chronic disease, which again increase the risk and severity of COVID-19. So this is just a picture of death and a race and hospitalization put out by the CDC, last updated November the 30th. And as you can see here, Black, African-American, non-Hispanic persons and Hispanic Latino persons have higher rates of hospitalizations and deaths as compared to their white Hispanic counterparts. So why is that? Well, when we think of disease, we think of physical aspects of disease, but we have to look outside of that. And so we believe that this is so because people are in this demographic may not have access to testing. They may live in high density areas, be more exposed to pollution, have pre-existing conditions, and be essential workers. And on top of that, we have racial biases in the healthcare system that really increase our ability to get COVID-19 and it be more severe. So if we look at the rates that are highest, we think of some of the diseases that we have in our community that are most prevalent among African-Americans and Blacks. We have high blood pressure and chronic kidney disease. When we look at Hispanics and Black, we have the highest prevalence of diabetes. And what's interesting is that even though we have these comorbid conditions, if we make it to the hospital, if we get the care, we will fare as well as or better than our white counterpart. Other factors include crowding, the tendency to work in essential jobs that can't be done remotely, the reduction of access to healthcare. We have people that are still underinsured or uninsured. There's delays in seeking care, receiving care in clinics, or the hospitals lacking the resources. Again, we have these higher rates of underlying diseases in our community, and it's impacted by our low economic status and lower educational attainment. So this just kind of bears that point home in Los Angeles County. If we look at the mortality rate among African Americans and Hispanic Latinos, we see it's the highest. And if we see, look at the areas of poverty, we see that those that are highest in poverty have the highest mortality rate. So we talk about living and working conditions. There was a report, and many of them actually in agreement with this, is that when we talk about Hispanics, they really report working while ill, more so than their non-Hispanic counterparts. And they work in essential jobs, and they have households where there may be more than 4 people or more living in a small cramped area. And then it's also reported that they will probably be exposed to infected household contacts, and that they report exposure both inside and outside the household. So why do risk factors matter? Well, people with risk factors, they may be more likely to need hospitalization or intensive care and more likely to die from the infection. So it's very important that we learn about the risk factors so that we can take precautions as we go about our daily lives. We can better understand how a medical condition can affect our own health when we get sick. We can anticipate our medical treatment that we may need if we get sick. We can reduce the risk of severe COVID-19 illnesses by managing any conditions you have that are risk factors, and we know diabetes and hypertension are the most prominent. Then we can protect ourselves, our family, and our community. So in protecting yourself, family, and community, it's really important that you social distance, that you wear masks when you're going outside at all times. And now in LA County, we want you to wear masks inside. Household contacts are really high, and that we see an increased number of people that are asymptomatic catching COVID-19 in households. Wash your hands frequently. You got to avoid touching your face, nose and mouth. Most people think about, but they forget about their eyes until you've washed your hands. Stay connected with your friends and family via phone, Zoom, or other virtual mechanisms, and we'll have someone talk about that and how that impacts your mental health. Exercise and monitor your use of alcohol. It's been reported that over 17% increase in the use of alcohol since COVID-19 has started among those that drink. Talk to your physician about the vaccine and understand, most importantly, the risks and benefits. There's so many conspiracy theories out there, and everyone has a reason why this is happening in our community, but be informed. Go to your public health website and get updated and accurate information, and comply. Please comply with the stay-at-home orders. Now, this graph really tells you why you need to comply with the stay-at-home orders. If you look in March of 2000, you can see the graph is kind of low. Then we started closing out the gyms, retail shops, and the bars. And then we had a little opening, and then we saw a bump in COVID-19, and then we closed everything down. As we went to private gatherings were permitted, and then we see personal care opening. And then all of a sudden we had a 941% increase in the rise of COVID-19. And that's when we had the stay-at-home orders. So if anything, if you can keep this in your mind, when you go out only for essential needs. And most importantly, wear your mask, but staying at home is really the key to stopping this. So everybody talked about the challenges of COVID-19, but really there are a lot of opportunities that we have when we talk about health disparities. First of all, we've talked about health disparities for many, many years, but all of a sudden COVID-19 brought this to light about the disparities in our communities of color. So it's really important now that we push this forward and make sure that we're provided more data, that we are learning more and economic conditions that put us in higher risk, and that we work with our communities and healthcare providers so we can reduce the cultural barriers that exist. We definitely need to identify and address implicit bias that hinders patient-provider interactions and communications, and demand that we get immediate funding for health research to eliminate the disparities. And most importantly, we've got to engage our communities to build trust, because that, I think, is what is missing in this era, and that's perpetuating all the conspiracy myths and that are in our community at this time. So with that, I thank you.